when COVID struck, the hospitals, the clinics in my country were not allowed to open. And so we worked as volunteer emergency room physicians to see COVID patients in the front lines. One day I saw a news article in Cision Newswire that ExocoBio was holding a regenerative medicine summit on exosomes. And so I was very interested in finding out how I could join that, and I emailed every address that I could find that was connected to that article.
We applied the devices and the exosomes before surgery and after surgery. And what it has done for us, it has really improved our results, increased the longevity of our results, and most importantly, we noticed that these patients are extremely satisfied.
I think for most physicians, the most important part is science, safety, and efficacy. So we look into the amount of publications that's being done, how invested the company is in research and development, looking into finding out the science behind it and not just only commercial and marketing.
The first thing that really got me was the number of scientific papers. It's very well known that ExocoBio has the most number and important papers in the market. So it's really interesting for me to be one of the first Brazilian to be in Korea, to understand this new technology and to introduce this to a great market in Brazil.
I was invited as a speaker to RAES symposium in Seoul. Tonight I will be talking about plant-derived extracellular vesicles because this is a topic that fascinates me, the technology which is behind it. This case report was awarded by ExocoBio, so I feel very honored to be invited to present it.
Tonight, it will be my great pleasure to attend the RAES conference that held by the ExocoBio and also the BNF company. I have experience and also treat the patient with the exosome. They show very great result and efficacy. I can see the result of the acne scar treatment with fractional CO2, picocycle laser, infinite microneedle or any microneedle RF. They can significantly decrease the downtime, maybe from 7 days to only 1 day.
ExocoBio and BNF have actually put their messaging out there but are backing it up with clinical work. So by having a GMP facility, which is not big, it's huge as far as what we need. So I'm excited to see where they go next.
ExocoBio Factory was some of the highlights of my trip so far. What's fascinating about that is this production facility is making exosomes. So it's new, it's exciting technology. I think that they are doing an excellent job in how they're producing these exosomes. We have so much to learn about this intracellular communication, microvesicle, that in dermatology and in medicine in a general sense, we hope to see more and more from this technology in the future to help our patients.
I use ExocoBio products. Actually, I use them all. I use the all range of ExocoBio products, and I also like the balm. I use it personally myself. I have one patient who had a cut on herself. Now, when she came to see me, it's not only the keloid, but she also had atrophic skin because of steroid injections. And then I told her that I have a better solution for her. I combined it with exosome treatments, and it's like 80-90% improvements. I was so happy for the patient that I have solution for these difficult problems.
When I started my experience in my clinic, I used to use PRP for the growth factors. When I met exosomes developed by ExocoBio 4 years ago, I saw the possibilities
and in many cases like scars, hair loss, alopecia, and skin quality. And actually, in my practice, I use it always in my clinic.
I think the Exosomes and ExoBio has a lot of opportunities to do new medical advices. We need to generate new opportunities and new advices and new technology for these exosomes because the applications in dermatology is so well. We are using two ExoBio, the exosomes, for the clinical practice, and so there is important at all.
The hope and future of exosomes could be, from what I've learned in this meeting, to accelerate recovery and repair, and that definitely fits into what I was sharing in terms of where consumers' mindsets are and their desires.
This is just the beginning of a revolutionary discovery in medicine. There's a lot more ExoBio exosome can offer. So being a practitioner, I can see the benefit or the medical problem can get from the ExoBio exosome. So this is the future and it's your future.